So, what is the best approach to pain management, you ask? Let's talk about it today. I'm going to talk about the triple threat to relieving pain and healing injury. And I'm going to talk about how to create the perfect plan that's actually realistic and that will get you the results that you're looking for.
Hello, and welcome to the Pain Free Lifestyle Podcast. I am your host, Rebecca Geiger. I am a pain management coach and neuromuscular therapist. I want to share specific strategies and tools to help you get out of pain so you can live a happy and healthy lifestyle. If you're interested in that, please subscribe to the podcast, give this episode a like, and also comment on what your biggest takeaway was from today's episode. Let's get into it.
The triple threat. What is the triple threat? I call massage, chiropractic work, and physical therapy the triple threat for relieving pain and healing injury. All too often, these things are looked at individually, and even people within each profession believe that what they're doing is the only thing that works. And if it doesn't work, then, you might as well get some surgery or just know that you have to live with this pain forever. So not true. However, there are also really great folks in these industries that realize that what they do is better supported when they all work together. So I'm going to talk about what the main focus of each approach is, also the limitations of each approach and how they overlap. So for massage therapy, the main focus of massage and the way I look at massage is to restore the normal function and normal resting length of the muscle. And really, by restoring the normal muscle length, you are allowing it to function properly. I'll explain that in a minute when I get into physical therapy. But the goal is to essentially, yes, relax the muscle. So you relieve the tension from the muscle. So then the muscle basically is prepared for action, for mobility, for the things that are required for the other treatments and for daily living. So massage itself takes the muscle fibers. So a quick little anatomy lesson. Your muscles are made up of primarily two fibers, actin and myosin. And these fibers work together. They interlock with one another to create a contraction to maintain that strength. And what happens with repetitive use or some sort of imbalance in your body is these fibers kind of get stuck together. And this can create trigger points. This can create knots, among other things. And there's can be restrictions and adhesions in the tissue. So basically, they get stuck together. And what massage does is unstick them. It helps that muscle to relax. It tells the brain to relax the muscle. It physically releases the gunk in the muscle for those fibers to then relax. So then they are able to fully contract. Because if you've ever done a bicep with your elbow, a bicep curl with your elbow bent, that's much harder than with your elbow fully extended. And that's because the muscles are already shortened. Those fibers are already coming together. So you have less power. That's how massage can improve your performance and improve your power by allowing that muscle to get to its normal resting length. Now, with chiropractic work, the main focus of chiropractic work is to align your joints. Basically, align your spine, get your joints in their optimal position. Also, with chiropractic work, especially along the spine, they focus on restoring the nerve function, restoring that nerve pathway, because all of your spinal nerves come out of your spine to then dissipate throughout the rest of your body. And so their main focus is just to get you realigned, to decrease inflammation that may be contributing to some of that nerve pain, just the actual change or misalignment in a joint or the spine can be contributing to those nerve pains as well. And so their main focus, again, is just on realigning your structure, your bones. So massage is focused more on muscle. Chiropractor is focused more on bone. And then with physical therapy, their main focus is really about balancing strength and weakness to eliminate weakness and produce strength. Now, every action has an equal and opposite reaction. So as you are strengthening, let's say, the bicep, you are naturally stretching and relaxing the tricep. The tricep has to relax in order for the bicep to contract. So if you actually have an issue contracting your bicep, could be shortness in your tricep. And that's with every single part of your body. And all too often, physical therapy is looked at as the only thing in our medical field that is prescribed before a doctor would go straight to surgery. And that's really unfortunate because it's not the only thing. Yes, it's important. It's important to rebalance that strength and weakness. But why is that muscle imbalance occurring in the first place? So the main focus of physical therapy is to identify weaknesses and improve strength. So next, let's talk about the limitations of each one of these. So massage therapy's limitation is you can relax that muscle and restore its normal length, but if it does have some weakness in it and you don't address that, you're never going to get better. If there is a joint out of place, relaxing that muscle can help to bring that joint back. However, if the joint is still out of place, that massage or that muscle is going to continue to get shortened or return to a shortened state because the joint has never been addressed. With chiropractic work, you can restore that joint, but if it's due to a muscle that's being shortened or tight, then it can just pull that joint right back out of place. Also, if the reason that that joint is out of place is because of a true weakness or strength issue, not doing any physical therapy will basically prevent that joint from staying in the position and then it will come back out. That makes sense. Now, with physical therapy, its limitation is that the focus is just on strength or weakness. And that's not always the case because your muscle could be shut down by your brain. It's something called neurologic inhibition. And that's where the brain recognizes or senses that this muscle is at risk or it is going to be injured or maybe it's already injured. And so it turns it off. And so you need to turn that muscle back on with massage in order to prepare it for the physical therapy. And if you have an imbalance in the joints or in the spine, and you're not addressing that, no matter how much exercise you're doing, it's going to revert back because you need to reposition that joint. Now, I will say sometimes you can fully restore the joint by doing PT and massage, but it's only in a case of probably something that's acutely happening. One more note on neurologic inhibition. I look at it like your brain is the union and your body parts, your muscles are all the workers. And so when the brain senses that these workers are not getting paid right, they're not getting enough rest, they shut it down. They say, you are on strike. And then once you do give it more rest, give it the care and proper love that it needs and pay it right, then the brain will turn it back on. Now, let's talk about how these three overlap and why they are so important to do together. One of the biggest problems right now in the way our medical system is treating these musculoskeletal issues is that basically you go see a doctor. Normally you have to see your primary care doctor. Sometimes you don't. It kind of depends on your insurance, but you would see your primary care doctor. They refer you to a specialist, which is usually a surgeon. You see the surgeon. They give you some x-rays, find out nothing's really serious going on. So let's do PT for 6 weeks. If PT doesn't work for 6 weeks, then we'll consider surgery and other options. However, if they would just incorporate chiropractic work and massage therapy through that physical therapy process, the patients would get such better results. You are completely missing two huge components of the physical that can really be helpful and often are the things that are missed and overlooked and can be the most beneficial. And I do not think massage, chiropractor, or PT on their own are the best. It depends on who you talk to. It depends on if you're talking to a person or you're talking to their ego of what they think. But a lot of times, and I do see this in physical therapy, where it's basically like, well, if I can't help you, then you probably do need surgery. And like that's only reinforced by our medical system, which, like all systems, we need a little bit of reform, I guess, and we need to change things. However, when you can't change those things, this is why I'm doing what I'm doing, is to help you see that there are other options, there are other things that you can do. Maybe insurance will pay for it, maybe it won't. Who knows? But you do have options. And over time, I do think these things will change because at one point, chiropractic work wasn't even looked at as medical care. And now that it's not, and even though it's not always recommended, during these things, insurance is covering it for the majority of folks. And that's really nice and helps with the overall overhead of your medical and self-care expenses. But let's just go back to how they overlap. So when you have the muscle, say this is repetitive use injury, and you restore that length, you work out, the knots, the trigger points, the adhesions and stuff, get that muscle to where it has a normal length. Then you can do physical therapy to actually strengthen what's truly weak in that muscle. And you can combine that with chiropractic work that will, again, restore the placement of the joint and restore your alignment. So you need proper alignment to move. Now, sometimes massage is the thing that you're missing. Sometimes chiropractor is the thing that you're missing. Sometimes PT is the thing that you're missing. Each one on its own has its benefit, but it also has those limitations. And if you realize that they all work together and actually implement a plan where they do work together, I'm telling you, you are going to see great results. So if you're someone who's like, I've done PT, it hasn't worked, I really recommend doing some massage therapy and maybe even some chiropractic work and see if that's the thing that you're missing, and then going back to your PT, and you may find that it's more effective. There's one law that I really want to talk to you about, and this really explains how everything kind of is intertwined. It's a law called Hilton's Law. And this basically states that when you treat the muscle, you affect the joint and the fascia. When you treat the fascia, you affect the joint and the muscle. When you treat the joint, you affect the muscle and the fascia. So each time you work on each one of them or have each approach, you're getting some effect to other categories. However, it's not the full picture. And the best approach would be to do something that directly affects each one of these. So if you don't know what the fascia is, that is just some supportive and connective tissue. It really connects our entire body together. You have fascia that's underneath your skin that kind of gives you the shape of your body. That is a protective, supportive structure right under your skin. And then you have deep fascia, and this is the connective tissue that separates and kind of organizes your muscle groups. And so that is all connected. And there are some people, again, who think that like that's the only way. And to be honest, none of these 100% directly just affects the fascia. They all actually indirectly affect the fascia. I'll talk in a moment about something or a couple things that directly impact the fascia. But Hilton's Law still brings these three things together. Again, the best approach is really to combine these three things. Now, with the fascia, other ways that you can impact the fascia, and this can be really, it does fall under massage therapy. Again, it depends on the practitioner, what their specialty is. My focus on massage is muscle centric. My main certification and the main modalities and techniques that I use do fall under precision neuromuscular therapy. However, there are other approaches that you can do that can help to restore the fascia. There is actual myofascial manipulation that you can do. There's craniosacral therapy, which is a very gentle form working on the flow of the cerebrospinal fluid and then affecting the fascia from like a centralized point coming outward, where that kind of overlaps a bit with chiropractic work. There's also something called rolfing, which is a myofascial technique as well that is just more of a deeper fascial work. And I typically tend to go somewhere not necessarily light, but I like more gentle, ease in, trick the body a little bit before just going aggressive, because we're already so stressed that I don't want to add to that stress by like jolting you, if that makes sense. Now, things that you can do on your own that affect the fascia are yoga and Pilates. Now, yoga, especially when you're doing yin yoga or restorative yoga, and this is where you're holding poses for a good 3 to 5 minutes. And in order to affect your fascia, which is made up of elastin and collagen fibers, you have to hold a gentle stretch for 60 to 90 seconds to actually affect those fibers for lasting change. Now, Pilates is also something that affects fascia through just the gentle stretching that you're doing in the movements and the holds, similar to yoga. But this also really crosses over with physical therapy. Now, Pilates is not a replacement for physical therapy, but there are a lot of physical therapy centers out there who use Pilates as therapy. And Pilates was originally developed by Joseph Pilates for rehabilitation in the hospitals. And so Pilates is really focused on core and building core strength. So then you move from your core, so everything else kind of flows. Often we have a lot of core imbalances that are at the root cause of a lot of our pains and discomforts. But Pilates, again, is not a replacement for physical therapy. However, I think it's a wonderful maintenance plan for physical therapy or preventative. So once you are through physical therapy, doing Pilates regularly will help maintain all that you built during physical therapy and provide a whole body core supported strength for you. Also, say you haven't experienced an injury yet, but you're starting to feel a little bit of pains here and there, getting into Pilates now. And I want like classical Pilates, not like power Pilates, yoga Pilates, or what pump Pilates or any of the other stuff, like classical Pilates, where your focus is on strengthening the core and moving all of your joints and all of the ranges of motion, like circumducting your hip. If you don't use it, you're going to lose it. And so we need to be moving our body in the way that our body is designed to move. And at normal gyms and most gyms, you're not moving your joints in all of those areas. So Pilates and yoga and massage and chiropractor and physical therapy, all of this stuff really supports your body and allows you to go to the gym to build strength or whatever that looks like for you, however you are building strength. There's lots of ways to do it, and you got to find a way that works for you. But the point is, you do want to build muscle, build strength. Therefore, why? Why do you want to do that? Well, number one, to be healthy, right? To have a good, healthy quality of life where you're feeling good for the rest of your life and you have a small amount of decrepitude before you die. So you can just live your daily life. So you can play with your kids, play with your grandkids. So you can go skiing, you can go on hiking trips, you can go on vacation. You can just randomly go meet up with a friend and take a 5-mile hike and not be out of breath. Just so you can live your life. So you can carry groceries in the house one trip. So if you feel like, having a refresh in your bedroom, you can move your bed yourself. You don't have to wait for somebody to do it or hire, some sort of moving company just to move, a couple pieces of furniture. These are things that you can do. So that's why we work out. Again, as we're aging, we definitely want to be cautious of, like preventing ourselves from hurting ourselves if we were to fall. There's lots of ways, and I talked about this in episode 5. I talked about the components of physical fitness. So definitely go listen to that, because that will tell you a little bit more in detail some of those things. Now, how can you create a treatment plan that is realistic for you? So like I mentioned, massage, chiropractic work, and physical therapy all work together. And maybe you've already tried one. Maybe you've been to a chiropractor, you've been for a year and you've got some results, but nothing's changing. Okay, so wherever you are, just go to the next step. Go then, keep up with your chiropractic work or limit the number of sessions that you're having. Say you're going every week right now. Okay, take that and go every other week and schedule yourself a massage with a qualified massage therapist, not just relaxation massage, with someone who can confidently treat and assess your situation to help you create a treatment plan within the massage for yourself. Now, often when you are first starting out with any sort of therapy, most of the time they're going to want you to come in more often at first. And to be honest, that is the best approach. You don't want to wait too long because you're just going to work on the same thing. However, you have to be realistic about your schedule and about your finances and what you are able to spend time and money on and getting yourself back to feeling good. So again, if you're starting with chiropractic work, I would say, and you're going every week, cut that out to just maybe twice a month and then book a massage on the other time. So maybe start doing twice a month. Now, if you're doing that and you're like, okay, I'm feeling better, but I am feeling like there's still a little bit of pain here. All right, that now go incorporate physical therapy. So drop both of those down, okay, to once a month. So basically every 2 weeks, you're going to be seeing someone. So every 2 weeks, you're going to see the chiropractor or the massage therapist. And now every day, your focus is on your physical therapy. And most physical therapy programs are going to be anywhere from 6 to 12 weeks. So anything that you do, you got to give it the time. Okay. You have to give it time to work and not switch up too much too quickly. Now, if you are able and you want to maintain, weekly sessions, seeing chiropractor or massage, it all depends on obviously your time, your finances, and how severe your pain is. For me right now, with the hip issue that I'm dealing with, and I talked to you about healing this old injury that I have and recurring pains, it was pretty bad. Like it actually feels really good. Right now I can sit and I don't have pain in my back, which is great. I can feel a little bit of tension and I can feel a little bit of like very light pain or discomfort like on the outside of my hip when I'm sitting. Such an improvement from where it was. But I was going starting 3 weeks ago. I had massage, like a massage on a Tuesday, chiropractor on a Wednesday, chiropractor the next week, chiropractor last week, and I'm seeing chiropractor tomorrow. And then next week, I am getting a massage. And then the week after that, I'm getting chiropractic work. So at first, it was every week because I want to stay on top of it. And so I want to get it done. And here's the other thing. Massage, most of the often is not going to be covered by your insurance. There are some places that are able to do it, say it is part of a chiropractor practice. Insurance may not actually like cover it, but they might be able to go towards your deductible. But anyway, most of the time massage is not going to be covered. So that's going to be one of these expenses that you have to budget for out of pocket. And maybe why you only go once a month because it is more expensive than the other treatments. Now, physical therapy can be really expensive. Oh my gosh, like I paid thousands of dollars for physical therapy. I can't believe how expensive that was. That's like ridiculous. Even having insurance. And so now personally, I'm using an online service that's $12.99 a month. And again, I'm not talking to an actual person, but I feel that I'm on a really good plan. And I've been able to change it as I went along because originally I was doing a knee protocol. And then after 10 days, I realized really quickly that I really need to go to the hip, which I knew, I knew again, but I'm like, I'm just trying to go through the process. But it was great that I could switch my program and do that. And they had a really good assessment for that. Again, it's not going to replace actually seeing somebody, but it will definitely help you save money. And if you're knowledgeable and maybe even have some experience with physical therapy, then you'll be able to do it. And if you're really good or at least willing to listen to your body, it can work out really great for you. And then for chiropractic work, that is something that insurance does cover. And so, granted, you're only going in for 10 minutes. Like, so per minute, massage will be cheaper, obviously, but we're looking at the big picture, right? And so each session that I go in for is, like a fourth of what I would pay to get a massage. And so I'm able to do that every week. Plus, when I go in there, you got to get those adjustments. Anything that's out of alignment, you got to continue to like work on it and reduce that inflammation to help get it going. The same thing with massage. But again, you have to be realistic about your time and your budget. And those are resources that you have to keep in mind when making these decisions. And so doing the best thing for you. So anyway, going back to that, what we've decided is that, say you're starting out with the chiropractic work, right? You're doing that every week. Add in massage. Take 2 of those chiropractor appointments and do massage. And then after, a month or so, then switch to physical therapy, maybe drop both of those down to just once per month and incorporate your physical therapy. Now, once you're through with all of that and you're feeling good, then have a maintenance plan. Have a maintenance plan for how you're going to keep up with the physical therapy, like doing core and mobility exercises once a week or doing Pilates or having your physical therapist create a program for you to do, or even this app that I'm using, it has like a general kind of PT program for like general health that you can follow. And then, say I'm going to do monthly massages and every 6 weeks chiropractic work. That's what I'm doing right now. That's my plan. 6 weeks chiropractic work once I'm feeling better, and I'm almost there. And honestly, like if you really think about it, like the pain sucks so bad, it hurts. It makes you want to like just run to every single doctor that you can. And I'm not against that. You need to go see. Sometimes you need to see like is there something really serious? And also sometimes getting the peace of mind that nothing is really serious. And so definitely get things checked out. Once you know that, hey, nothing is serious is going on, like the pain is serious, Like I was having numbness and tingling. From my mid back to my middle thigh would hurt when I'm just sitting. Like that was kind of scary. My butt went numb. I'm feeling itchiness down into my foot. Like that is serious, but that's all just sciatic nerve entrapment. And so it's not really a big deal. It's more of a muscle issue. Give it the time. I wanted to just briefly talk about expectations. Yes, we want to be out of pain right now, but that's just not realistic. And what is realistic for you may not be realistic for me. And so the biggest thing is consistency and doing it over time. So whatever you're doing, you've got to commit to doing it for at least 3 months before you're like, wow, like this is not working. I'm still in pain. And if you've done that, if you have done all the things and you are still in pain, there are some areas that you have got to address. And to be honest, if you can address these during the process, you're just going to be a leg up because these are often things that are part of the problem in the first place. Number one, posture. How are you standing? How are you sitting? Are you leaning to one side? Are you resting your arm on a table or constantly with your work? Or you're doing repeated patterns, with like holding a phone or typing or whatever it is? Look at those, make adjustments where you can. How is your sleep? Are you actually getting 7 to 9 hours of sleep? And I don't mean just laying in bed for 7 to 9 hours, but are you getting quality sleep? Because that is when your body is repairing. It's so important to get sleep so your body can repair and restore. You get a lot of inflammation in your body by not sleeping enough. Also get inflammation by having improper nutrition. So how is your nutrition? Are there any things that you are actually allergic or sensitive to that you need to avoid? Are there things that you need to do in your diet to balance your blood sugar? Look at your nutrition and make some adjustments. Also, stress, overall stress. This is, yes, emotional stress, but also physical stress. Are you working out too much? Are you worried too much? Are you thinking too much? Where is your stress and what can you do to negate that? Also, emotional well-being. This really ties into stress, but where I think this is different is this goes behind the stress. Why are you stressed all the time? What are you worried about? What are you really thinking? And what are those fears that you have inside of you? And how are they showing up in your body? Can you address some of those fears and help your body to relax and let go of all of that to help yourself get out of pain? Okay, so let's recap a little bit. Today, we have talked about the triple threat for healing injuries and relieving pain. I really believe combining these three things are the best. Now, sometimes you're just missing one of them. Sometimes you're missing all of them. And when you're missing one thing, you might be like, oh my gosh, that's what I really needed. But the reality is probably that you needed them all. And so it's not about replacing one with the other, but figuring out a way for them to all work together. So create that realistic plan and stick to it. You got to give things time to work. And when that does not work or you don't get the results that you're looking for after those 3 months, I mean, honestly, it may just take a couple more months. Okay. That's part of it too. But during that process where you continue to work on it, explore those other areas and see what is truly holding you back from living a happy, healthy, pain-free life. Thanks so much for listening to the podcast today. If you feel so inclined, I'd love for you to share it with somebody that you think it would benefit. And I'd also love to hear your feedback and let me know what your biggest takeaway is from today's episode. Thank you so much. I hope you have an awesome day. And please go do something good for yourself because you deserve it. Bye.
Thank you so much for spending time with me, and I hope you enjoyed this episode of the Pain-Free Lifestyle Podcast. Please don't forget to subscribe, like this episode, and comment your biggest takeaway. Please remember that this podcast is intended for educational and entertainment purposes only. It does not replace medical advice. Always consult with your doctor for medical advice. I hope you have an awesome day, and I will see you in the next episode.